Welcome, everybody, to a special edition of the Grueling Crew Sports Network. Today, our guest from Replenishing Care, James Commerford. How you doing, James?
I'm doing really well, Mike. Nice to be with you again.
Now, last week, we talked at length about pulsed electromagnetic field therapy, or PEMF. Perhaps for those who missed it, could you briefly remind us of what PEMF is and what it does and how it works?
Yeah, absolutely. A PEMF machine is similar to a battery charger for cells. It puts an energy into the body that is drawn automatically to any cell that is undercharged electrically, causing those cells to constrict, force toxins out, and draw the energy in. And that may sound simple enough, but the wonderful thing about all of that is that when you put pulsed electromagnetic field energy into the body, it actually helps cells heal, repair, and perform at their best. And what happens for most folks is that after a short time, they'll tell us that they have increased range of motion, more energy, a greater sense of well-being, and ultimately are ready to get on with their day, more or less. So that is what a PEMF machine is in very simple language.
Yeah, and our topic today is back, joint, and muscle pain. Those injuries are amongst the biggest challenges for athletes and really everybody else, especially as you get older. How does PEMF help with those things? Well,
PEMF is one of the best things that anybody is going to find for those types of injuries. Basically the way that it works, and I'll get a little bit more detailed in terms of what it does for the body, is PEMF stimulates cellular metabolism, increases blood and fluid circulation, works in terms of delivering tissue regeneration, and boosts the immune system. So you see a lot of systemic improvement overall when you use it. And specific to spine, joints, back, and so forth, it stimulates muscles, stimulates connective tissues, tendons, cartilage, the brain, and peripheral nerve sites. So you start to see improvement in function. And if there's any kind of an injury, it will actually increase blood circulation in and around damaged tissue and actually helps the damaged tissue or cells heal by bringing more oxygen into the cells. So it actually accelerates injury or surgical recovery. So again, when you relate this to athletes, a lot of athletes, by virtue of the things that they're doing all the time, are very susceptible to those kinds of injuries, aches and pains, wear and tear, etc. So PEMF is a real effective way for them to help mitigate those effects and stay strong and healthy and on the field.
Now, can you give some examples of results you've seen with athletes?
Well, yeah, absolutely. In fact, I've been very fortunate over the years to have worked with athletes from NHL, NFL, NBA, UFC, and so on. But real interesting for me is that this week on Wednesday, I actually had the opportunity to work with 4 veteran players and 3 coaches from one of the Canadian Football League teams. And, I'll go down we'll begin with the players, obviously, because they were at least the current athletes in the room. What we dealt with literally across the board were neck issues, elbow issues, ankle, knee, rib, hamstring, back, and hands. And it was really an enjoyable experience because when you've been doing this for as long as I have, you're still really gratified to see great responses, but you're no longer really surprised. So in each one of these cases, I had a couple of 30-year-olds come in, each of whom was dealing with some kind of an issue. And what happens with PEMF, and this is one of its greatest features, is that the PEMF energy will be drawn to cells that need it. And essentially what happened with each one of the individuals who came in, and beginning with the first chap, he was a tackle that had taken a kind of an open helmet hit to the rib cage a little bit before in their last game. and he had all kinds of kind of pain in that area. So he put the device on his rib cage, and the look on his face as he just kind of smiled and said, first of all, how did it know to go there? But once he got over the understanding, or once we kind of repeated the explanation of why it went there, he just settled into the session and, worked on that particular issue for about 15 minutes and reported a tremendous change after doing so. We then worked on his neck that had been kind of an ongoing wear and tear issue. So we did a rope or wrap technique around his neck for about 10 minutes and increased the range of motion in that for him dramatically. And then we worked on his ankle. And he was pretty typical of each of the other three as well. One of the athletes was a running back, and he had a left knee issue as well as kind of a hamstring issue back there, so we worked on that. But it was really just, fabulous to be sitting and watching the expressions on the faces of people who are really in tune with their body and know what they're dealing with and know when something works. So those were some very recent examples working with athletes who literally, when they were leaving the room, felt a whole lot differently than they did when they came in.
Yeah, and not everybody's a professional athlete, but even if you're not a professional athlete, I mean, this can be even more important to you. You want to tell us some examples of results you've seen working with weekend warriors and non-athletes?
Well, the great lead into that was after we were done with the players, I had the chance to work with 3 coaches. And these were very fit people who I think in their day were very active as players, who've now moved on to coaching and taking care of players. So each one of these 3 gentlemen likewise had some issues that were happening. So in the case of, it was really kind of a cute thing the way it happened. We had, I was there to visit with one specific coach, and in the process of waiting for the players to arrive, he had a colleague of his there, and when I started to explain the device to him, he said, well, would you like to give it a try? And so we started working on his elbow that had sort of a long-term injury going back and was painful and very limited range of motion. And after about 5 minutes, he kind of asked if we could do it again. Then he actually took his cell phone, changed the time of the meeting that he had that was upcoming, and stayed longer on his elbow. Then we worked on his Achilles heel that he'd had an injury and surgery on years and years ago. We then worked on his hip, and after his interview was actually what he had, he came back to see us again. So we thought that was a pretty good indication of somebody responding to us. And I had a real privilege that night of working with the head coach of the team, and we did an overall session with him that went literally, for about an hour or so and kind of went head to toe. But there were some issues specific to him as well, neck and so on, some issues around the hips. And he had a dramatic response to it as well. So I'm going to classify them as weekend warriors, if you will. And then if you kind of swing it over to folks who've maybe never been what they would term themselves as athletic, or people who've been real involved in sports, they likewise develop wear and tear injury. They likewise have things that start to hurt. And the great thing about PEMF is that it doesn't discriminate. It literally works with whatever a person has to work with to heal and repair. And that's why, we say an athlete will experience, or about 95% of them, as was the case this week, will report increased range of motion, more energy, greater sense of well-being, and so forth after 15 or so minutes of this. But likewise, will a person who's never considered themselves an athlete, again, they'll have generally those same types of responses in accordance with their ability to heal. So it's really applicable to all.
Yeah, so how specifically do you use PEMF to help athletes reduce, prevent, recover from back, joint, muscle pain, or injury? And I also know this, because I've used it before with Dr. Fick over here in Cincinnati, but even if you don't have any pain somewhere, you still feel better after you use this.
Absolutely, and that's one of the important things. In fact, you kind of led into our approach to it. I mean, we use PEMF to help people get, become and stay well or fit, if you will, or just generally healthy. We also use it in an issue-specific way, such as like we're talking about now, back and joint type issues. So as part of, that application or that kind of broad-based application, we have a series of protocols that we've developed that specifically use certain coils that come with the machine to target certain areas of the body most effectively. And in the case of treating somebody who's dealing with, a specific back or spine or joint type issue, we have an approach to that, and we also have a very general approach. So what I would describe for most people is if you want to imagine using something that's about a kind of like a circle, if you want to imagine what the applicator looks like, and we will apply that for most people lying face down on either a massaged or flat surface, and we'll put the coil basically around their backside. Then we'll move it the width of the coil up over the center of the back, and then one more time up over into the shoulder area. And for the folks we were dealing with this week who were fairly tall individuals, we actually moved the coil up about 4 spaces to cover the whole area of their backs. We then have a way of putting the shoulder or the arm through the coil and pulling it out into the front of the shoulder and then kind of out across the back. And we do the same thing for the hips. So there's a very easy way of treating those areas. At the risk of downloading here, we also, and you mentioned Replenishing Care, we like to apply a concept we call stacking, where we put, combination of things together to deliver an even better outcome, but also to give people the best possible outcome in the minimal amount of their time. So some years ago, I was blessed to meet a chiropractor out of Boulder, Colorado, who taught me a technique called pelvic correction technique, in which we use pelvic blocking to help reverse what is called functional short leg differential, which pretty much every one of us gets. And the vernacular for that is having one leg shorter than the other, and some people joke about that, even though it's really not a laughing matter. So if you want to imagine what we do when we're working with an athlete or any individual, is we will actually administer a very, what I call basic level of pelvic blocking. It's very simple to learn. We're not trying to turn people into, armchair chiropractors in doing this. It's very, very simple to learn. And it's very much like a dentist teaching you to brush and floss your teeth, except this is a way that you can take better care of your spine if you know how to do this. And, in fact, I've even had NFL players teach other NFL players how to do this in camp using sneakers stuffed with socks. So you can imagine when I was meeting with these gentlemen this week, we talked about that same example, and every one of them went out knowing how to actually use pelvic blocking in a safe way. And another part of the technique that's probably a little more complex to get into in this discussion, but we have an ingenious neck roll technique that helps people maintain or reestablish the contour of the neck or the cervical spine, and also do something that's complementary to the pelvic blocking technique. So when we actually work with PEMF, we will have a person lying on their stomach, the blocks in place, and then we apply the PEMF coils up and down their spine, into the shoulder area, into the hip area. So you've actually helped balance any structural imbalance that was there at the outset. So typically you're getting the benefits of 2 therapies at once, and you're also enabling the PEMF energy to travel much more freely up and down the body and hit some of those spots where there may be some kind of tingling in the case of the fingers with some of the football players who were there this week, or, loss of range of motion in some of the other extremities.
All right, so how does somebody get PEMF?
Well, in a lot of cases, teams will get the device and use it in the locker room or have it in the locker room so players have access to it that way. Some people will take the approach of finding a local practitioner who offers the services. And, of course, the other way is you can get in contact with us and we'll fix you up with one of your own.
Yeah, so actually an athlete or individual can buy one, correct?
Totally. And, in fact, that's becoming more and more, what people are doing as they discover the true power and value of PEMF for, back and those types of injuries, but just about everything else as well.
All right, so how much does the PEMF machine cost?
Well, I'm going to answer that in gold, silver, and bronze. And when I say that, a PEMF machine with the full package, like the one I was using with the football players this week, is $21,500, and that's the full complement of coils that we have that we recommend as part of our athletic training and sports medicine protocols and personal proficiency, if you will. And that's the one that is what I would call a best seller, and I'll kind of call that the gold, if you will. But I'd always be very excited if I ever had a silver. So the silver level device is a little less powerful as the gold one, and it'll come in at about $14,000. And then the bronze, which is another great option for people, again, a little less power than the silver, but a very effective device. That's going to be down around $7,000. So, either one of those options will work very, very well for people. Either one obviously represents an investment, but when people understand just how much it can do for them, for many people it's an investment they're very happy to make.
All right, so this is the big question, because if I'm sitting here and I don't know anything about it, I've never seen the machine, the first thing I'm going to think is, how easy is it to use, and do you guys train me to use that if I buy one?
Yeah, great question, and thank you for that. A PEMF machine is exceptionally easy to use. I mean, I can have somebody functional on it in about 15 minutes. And, in the case of the coaches and the players who were there this week, many of whom have training in health-related things or athletic training type things, or have just been around therapies for a long time, it's real easy to have them use the machine or learn to use it efficiently very quickly. But the gold standard of using PEMF or any other therapy is being shown the optimal way to use it, and we provide training with everything that we represent across a set of kind of proficiencies. So we have a personal proficiency we teach people, which would help someone help themselves or others. We also teach practitioners the professional proficiency of how to use it in a practice. And then we get into the athletic training and sports medicine applications. We also have a team kind of set of training, and then ultimately there is something we call Replenishing Care, which is a full-blown ascending fitness and personal best performance system. But, as much as you hear all of those different modules, it's really, really simple to have somebody get comfortable using this device, getting great results, using it safely and comfortably right out of the gate. And then we kind of bring them along at the pace that's best for them. And we deliver training to them in accordance with what their goals and purposes are of having the technology in the first place.
All right, so if anybody wants to find out more about PEMF or Replenishing Care, what is the website they can go to find that out?
Yeah, the technology website, the one for PEMF, is www.replenishingtechnologies.com. And we have an affiliate one that we've referenced here a couple of times, which is www.replenishingcare.com. And you'll see kind of the bridging between the two sites. But, again, the first one is specific to PEMF and the technology we use this week with the players and coaches. The Replenishing Care model is something that takes PEMF and actually adds 10 other things to it to help people put together a very integrated approach to fitness, wellness, and overall health performance.
All right, James. As always, it was a pleasure having you on, and I can say I've used this machine. My entire family's used this machine at one point or the other, and it's an amazing machine. If you want to stay healthy, it's the best way to do it. If you want to stay feeling well, even as you get older, it's the way to do it, and that's why I think the PEMF machine is the future of sports medicine. James, I want to thank you for coming in again. Do you have any final words?
No, just wishing everybody the best, and for athletes that are training to get ready to go on the field or those that are going to be in competition this week, play well, play safe, and we'll look forward to maybe chatting with you sometime.
All right, guys, remember you can go to www.thegruelingtruth.net and click on the Replenishing Care banner at the top of the website. That'll take you directly to the website also. Remember, Monday at noon we will start our daily Survive and Advance with myself and former Indiana University basketball legend Steve Risley. I said that just for him because he's got a large ego if he's listening in. He played he won a 1981 national championship. On Monday, we will have Bryce Fields, who's an NBA beat writer, on to talk about the NBA draft. Tuesday at 11 o'clock in the morning, you can hear us live on thegruelingtruth.net as I'll be interviewing a man who, when he retired, was the third leading scorer in NFL history, former San Diego Charger kicker John Carney. And then, of course, Survive and Advance all week at noon. We'll have guests all week long. Next Friday, we'll have award-winning author John Responte in to talk a little boxing. He wrote the Ward Gotti trilogy book, Intimate Warfare, with Dennis Taylor. And just follow us at Grueling Truth on Twitter for all show updates, guest updates on that show. You can also go find our Facebook group, of course, the Grueling Truth Sports Network, on Facebook. So for James G. Commerford, I'm Mike Goodpaster. You've been listening to The Grueling Truth, where the legends speak.